if I do this, how many more times I have to do it in my lifetime? And that's a very good question. Keep in mind with veneers, you cannot go back. You cannot go back to where you didn't have veneers and say, okay, now I don't want it anymore. I just want to do, have my own teeth, natural virgin teeth. That's not going to happen. Your teeth are touched. There's glue on them. You are going to need veneers for the rest of your life. So remember that it's a commitment. It's not something that you can do once and then change your mind in the future. Even get a second opinion from a different dental health professional, qualified of course, and make sure that you know all the ins and outs, ups and downs, and advantages and disadvantages of the treatment, because it's not something that you can later on regret and say, you know what, I don't want it anymore, I want to take everything off. If you have any questions, I'm here for you. Topic so far has been veneers.
Someone asked an interesting question from Zila. Is it good to keep changing toothpaste?
That's a very interesting question. There's a lot of different opinions about it by different researchers and even dentists. As long as your toothpaste has fluoride, I'm happy. Because the whole point of toothpaste, they have some small gritty material to basically clean the surface of the tooth and make sure that food and bacteria and plaque is removed. But also they have usually fluoride in them. Fluoride will go into the structure of your enamel and make your enamel stronger than what it actually was. So the enamel you're born with is not as strong as the enamel that is exposed to fluoride. Any toothpaste you're going to choose the one with fluoride. And also, that's it. I wouldn't say anything else. To change your toothpaste, it's not a bad idea every now and then to have a different one. But at the end of the day, if they have these ingredients, that's all your dentist cares about. That's all that we want for you.
Perfect. Maybe we should remind the guys on Instagram that we are doing the live
yes.
at the same time.
Guys, the reason I look that way is that I am live on YouTube. The YouTube live link is on our stories, so please join us on YouTube, because I'm only answering the questions that are coming through our YouTube channel, and I added this here to remind you that we're on YouTube live right now.
Alright, so should we just close the Instagram and continue on YouTube?
I think it's a good idea for it to be on, because they can hear and they can, then join here. If you have any questions, you have to join our YouTube live, because I can read this stuff here better and I can answer everything, okay?
Awesome. So I got a question from, I think someone named Minu, your name.
Namesake.
It's not about like treatments. She asked that how to decide on getting the specialty, like which specialty should we get?
So the question is how to decide on which dental specialty to go toward, and that's a very difficult question to answer. It really depends on what you like, I guess. That's the important thing to consider. You're gonna do this job day in, day out, morning to evening, and you want to make sure that it's something you love. You go to work happy and excited, because believe me, some days you don't want to go and you're going to be tired and you're going to be exhausted and you're going to be mentally just don't want to do it. So if you love your job, it's going to push you to pass that moment of, disappointment, I would say, and get back to the motivation you had before. I can't tell you which specialty is better. It really depends on what you like and what is more in demand, I guess, around you.
All right, amazing. So someone asked that between Invisalign or braces, should I choose Invisalign, yes or no?
I can't answer that question. It really depends on the situation in your mouth. Now, usually adults prefer Invisalign because it looks better, and I can show you an example. This is Invisalign. So it's clear liners. Where do I go? There you go. It's clear liners, and you can wear them when you, there you go. Yeah. So when you guys, I'm sorry. Clear aligners, you have to wear them day in, day out, 22 hours per day, and then only it will move your teeth. It will go somewhere, let's say around 1 year, 1.5 years, really depends on each patient. It might be as little as 3 months up to 3 years. Let's say that it's going to take 1 year. Invisalign is more convenient for most people rather than braces. Braces is more difficult for them because it's hard to clean, you know, it doesn't look as nice, especially for adults. But with braces, you don't have to worry about it. It's stuck to your teeth, it's doing its job 24/7, and all you need to do is just keep wearing them. Keep going back to your dentist every month or so you don't have to worry about it. If you ask me which one is better, is it better to have Invisalign or braces? I cannot tell you because in some cases we cannot do Invisalign and it has to be braces, or the person needs even surgery in the future. So a qualified dental professional has to examine your teeth and make sure that you are first of all suitable to go ahead with braces or Invisalign and explain for you which option is better. There is no way without seeing and examining someone I can tell you that yes, you can get braces or Invisalign. Guys, on Instagram, if you want to ask any questions, we are live on YouTube. And on YouTube, there is a YouTube chat that I'm answering all of your questions. So join our YouTube channel. YouTube link is on our stories.
Right. Thank you, Dr. Minu. We've got a question from Flora, I guess.
From who?
Flora.
Oh, okay.
I can't pronounce his name.
Bye bye. No, we are live right now. Right now. Yeah.
He's asking that he's interested to know about the veneers procedure from 0 to 100. Like, how do you start and how do you finish the veneer procedures?
Very interesting question. So someone wanted to know, how do we, from start to finish, how do we go with veneers? First of all, veneers are a layer of thin material that go on the surface of your teeth, only on the outer surface, and they make your teeth look different. So I cannot tell you right now if you're a suitable candidate to have veneers or if it's going to solve your problem unless myself or another qualified dental professional sees your teeth and examines your oral environment. But let's say for the sake of argument, you come here, I check, everything's good, we go ahead and say you can do veneers. First appointment usually, if you are going to get, let's say, 4 veneers on the top, would be to do teeth whitening on every other tooth in your mouth except the very back ones to make sure that you can get your veneers the whitest color possible. Second is that we take impressions, we do models, x-rays and everything, and we basically create that smile that you want. So we go ahead and ask you questions, ask you to send me some photos of whoever's smile you like. It might be your sister, it might be a celebrity, doesn't matter. I can show you some examples and make sure that I know what style do you want. I can show you different colors. Where is my color? There you go. We have shade selections that we can show you and make sure, do you want it really white? Do you want it just a little bit white? Do you want it matching with every other tooth? I have patients who say, I want my teeth to look exactly like what it was, the color. For example, I have a broken edge, I have a chip here, and that's what I want to fix. I also have patients who say, I want a full smile makeover, I want it Hollywood, I want it really, really white. What is your whitest color? That's completely your choice. Of course, I will also give you my input and what I think about it and what I think would work best for you. But at the end of the day, it is your decision. So first appointment, usually teeth whitening. Second appointment, usually taking your records, which is x-rays and models to create your wax up, your try-in veneers, your future temporaries. Third appointment, you come in and I prepare the teeth. To prepare your teeth, I have to usually polish a layer off from the front surface. Now, how much do we polish off? Sometimes it's minimal, it's 0.2 millimeters. Sometimes it's a millimeter and a half. And the more we have to polish off, the worse is for your tooth. That's just unfortunately the ugly truth. How can we do minimally prepped teeth, veneers, when your teeth are straight? So if you have teeth that are really sticking out, to straighten them by veneers usually is not a good idea because we have to cut that part that is really sticking out to make it look straight. If you have teeth that are aligned but you want to do veneers because of the color or a broken edge or shape, then we go with very minimally preparation. So on the third appointment, we prepare your teeth, and on the fourth appointment, we show you the veneers. If you're happy, we glue them on. After that, we have follow-ups and making sure that you're taking care of them properly. And usually we see you every 6 months for your examination, maybe dental cleaning. I think we have some questions on our YouTube channel. Just letting the guys know on our Instagram that we're answering all the questions on YouTube. I can't answer everywhere. So if you want to ask any questions, please join our YouTube channel, which is the link is in our stories. I have posted it a couple of times. And of course, give us a subscription because we would love to see you more. Do you want to read the questions or shall I? You can't see it? Sure. Can tooth whitening toothpaste really help? From Priyani. Very good question. I don't recommend tooth whitening toothpaste, and I cannot generalize this because it really depends on what's in the toothpaste. Tooth whitening toothpastes usually have gritty materials in them. Let's say charcoal toothpaste. Usually they have gritty materials in them. You can only whiten your teeth in two ways. Either it's physically or you put a gel on and it's chemically. Chemically, it's fine. Usually everyone should be okay to do it unless they have some sort of gum disease. So before you go ahead with any sort of teeth whitening procedure, go check with your dentist or hygienist or oral health therapist. Make sure your gums are healthy and you're not going to do damage to them. Let's say you're super healthy and you want to whiten your teeth. If the toothpaste you're using is using peroxide in it, which is a chemical agent that will dissolve color on the surface of your teeth, that should be safe as long as you stick to the duration that the dentist tells you to use or it's on the box. So you cannot use teeth whitening toothpaste forever. It's going to damage your teeth. But if it says 2 weeks or 1 month and your dentist is happy with it, sure, go ahead. If the tooth whitening toothpaste is whitening your teeth by having gritty substances in it, for example charcoal, that's going to be physically rubbing on your teeth and removing a layer of enamel, I would say absolutely chuck it out and don't use it. Because yes, of course, if I rub a layer off my enamel right now, the next layer is going to be super white, but it's going to get stained, and I'm going to do this again, or I'm going to get older. By aging, our enamel is going to thin slowly, and then you're not going to have enough enamel. You get sensitivity, you get cavities, and also if your enamel is thin, your teeth will look really yellow because the inside layer, unfortunately, is yellow. So you're going to do complete reverse to your teeth. I hope that answered Priyani's question. Guys, on Instagram, we are on YouTube Live now. So if you join our YouTube Live, you can ask any questions you have. I'm reading the questions over there and we're answering it there. Question from Arslan. Hello, how are you planning implantations? Do you use guide? What implant do you use in your practice? And also, do you use CAD-CAM in your practice? Thanks, Arslan. We do use CAD-CAM for crowns. We do Emax crowns, especially for the back teeth and zirconia, which is quite strong. We do use CAD-CAM. We scan the teeth and we design the tooth basically in the computer. So when we do the crown, instead of going home and waiting for the lab to make it, we make it in-house in 2 hours, put it on, make sure it's fine, glue it on, and you're done. So we definitely use CAD-CAM. Regarding implant, I don't use guides. I do freehand, but guides are also a good idea. What implants do you use? We use a Straumann, we use Aiden, and I think that's it. There are so many other brands that I use, but I don't remember them from the top of my head. What other questions I had? From Ida, should 8 years old get braces or wait till they are younger? Younger or older? Well, they can't wait till they're younger, but I know what you mean. So 8-year-olds, depending on 2 things. Boys grow later than girls. So girls will grow much faster and finish growing. For a girl, I would recommend go to your dentist or orthodontist and just get checked. Probably around the age of 8 would be a good idea. Even sooner doesn't hurt. To make sure that where are they on? There is a growth curvature that we check. We take a x-ray from their teeth, from their profile, and even from their wrist. Their wrist will show where they are in their growth procedure. So if they have already started growing, for example, at the age of, let's say, 10, we will rush the treatment, and we want to, use those growth hormones to our benefit. We don't want you to finish growing and then it's too late and you're going to need surgery. Remember, we can always make your teeth straight, almost whatever age you are, but we cannot change the relationship between your teeth as much whatever age you are. So for example, if your lower jaw is really sticking out like this, if you're an 8-year-old boy, fantastic. I can use all your growth hormones and basically bone structure while it's growing to your benefit, and make sure that I push this jaw back as much as possible and hope that I can make sure that you don't need surgery in the future. If you're 21, that's already too late. You're definitely going to need surgery because your jaw is really sticking out. Now, that's just an example, doesn't apply to everyone, but to answer this question of Ida, 8 years old is a good idea to check if you can start having braces or not. I cannot tell you exactly if yes or no, but it's not too late, and I don't think you should wait more before you check. You go to your dentist or orthodontist, they're gonna take x-rays from the head and from the wrist of your child, and they can determine where they are in their growth curve, and they can tell you if they can start now or you have to wait another year, or it won't be too late at the age of 8. I hope that was the answer to your question. Guys who are on Instagram, we are answering all the questions on YouTube, so please join us on our YouTube channel. If you have any questions, drop a message there, subscribe. We would love to see you there. Dr. Minu, it's Dr. Sayed here. Hi, and it's nice to see you everywhere. Thank you, Sayed. All right. Sagar, hi Minu Jam, what product do I use for sensitivity after whitening? Thanks in advance. Hi Sagar. So Sagar had Invisalign with me, and she's doing teeth whitening, and she says that I'm getting sensitivity. What should I use? If you are sensitive after teeth whitening, that's normal. If you have had Invisalign done, I had Invisalign done and I did teeth whitening, and unfortunately you get a bit more sensitive teeth if you had Invisalign done, because teeth have moved, some teeth have been polished, so enamel's a bit thinner. Anyways, if you're feeling sensitivity after whitening, the only thing that can help you is fluoride. That's it, nothing else. So if it's extreme, I had one person in my whole career who actually cried from it, and that was because she had a crack on the tooth. Go see your dentist if it's extreme. If it's just, annoying and zinging pain, use fluoride. Where can you get fluoride? From toothpaste. Now, there are some toothpaste that are very heavily fluoridated, and they are allowed by prescription, for example. So ask your dentist to write your prescription, you can buy it. What do? Right after teeth whitening, rub it on your teeth and don't wash it. Just sleep with it. It will really help. It helped me when I did whitening. The other material can be remineralization agents. So when you get teeth whitening, your teeth get demineralized. It means that minerals get out of your teeth a little bit. It gets dehydrated, it gets sensitive. Remineralization agents such as tooth mousse. I don't think I have it here to show you, sorry. Oh, I have the toothpaste. I'm not telling people to go buy this. You can ask your dentist and they can write it for you. It's called Nutraflor 5000 by Colgate. It has the most fluoride that you can safely use at home, as long as advised by a dentist or a dental health professional, not on YouTube. So again, don't hold me accountable for this, but that really helps. Second thing that helps, it's called a tooth mousse. In Australia, you can buy it at dentists, some pharmacies, and Woolworths, I've seen it. So that will remineralize your teeth. I hope that answer was good. Thank you so much for answering my question. Thank you, Sagar. Priyani, yes ma'am, thanks. Doctor said, is it okay to prescribe 2 toothpaste to use alternatively if patient have both sensitivity and teeth discoloration? Yes, definitely. It is completely fine. I have explained about tooth whitening toothpaste. I don't really recommend it unless your dentist have checked the ingredient and made sure that it's not rubbing and physically whitening your teeth. It's just whitening your teeth by chemicals, and you use it for a certain amount of time. But it is completely fine to do alternate toothpaste. I even sometimes tell my patient to use this one at night and that one in the morning. All right. From Yusuf, hello Dr. Mino, can I use tetric and cream on anterior teeth? Sorry, Yusuf, I don't know. Tetric and cream, what's that? I might be reading it wrong, or there might be a different name here for it. Priyanit, can veneers do sensitivity? Very general question. Usually, based on experience, when we do veneers, people have some sensitivity afterward because their teeth have been a little bit, you know, polished back and naked for a couple of hours. Usually the sensitivity goes away. I haven't had even one patient who kept having sensitivity after they did veneers. That being said, remember that when I tell my patients you shouldn't get veneers, your tooth is sticking out, you're going to need braces or Invisalign, I have to put this tooth back in, and they insist that no, I want veneers. Of course, when we shave the tooth, we have to shave it more, and it's going to cause more sensitivity. So the best way to do veneers, if the objective is to have whiter or different shape, would be to listen to your dentist and make sure that your teeth are straight and there is going to be minimal preparation. In that case, even if it does cause sensitivity, the sensitivity definitely 100% will go away. For my friends on Instagram, I just put this on here so you can see that we are live on YouTube, and I show you here, see? And people are asking questions and we are answering all the questions. I can't read the questions in both places because it will become too confusing. So if you can please join our Instagram, join our YouTube. Our YouTube account is on all of our stories from yesterday. I put it a couple of times so you can click on it and join us and give us a subscription. We would love to see you there. All right, hang on. Thank you so much for answering. Arsalan, I'm also a dentist from Kazakhstan. I work in digital dentistry, and I noticed that you are also use digital dentistry in your practice. How do you think digital dentistry becomes as precision as analog? All right, so an analog is basically a physical impression, and digital dentistry is when we scan your teeth, send it digitally to the lab. There are differences in it. Some labs say that, some technicians say that we prefer the analog, the physical impression, and some are happy with both. If your technician is happy with both, I would rather doing digital, because you know all that goo going in people's mouth and it's not nice, it's not comfortable. Doing digital would be preferable for me as long as my technician also is happy to use the digital. Otherwise, I have to go with what they say because you know they're the boss.
Maybe we should answer some questions that they asked before.
Of course. Let me, sorry. I think, yes, I have. All right. Yes, I have answered all the questions on YouTube. Guys, we're on YouTube. Join us on YouTube and then you can ask your questions.
All right. Someone asked that should I use a mouthwash in this day and age?
Interesting question. Mouthwash, I would tell my patients to use mouthwash when they are having some sort of gum inflammation, or if they have regular gum disease. I personally do not use mouthwash. Mouthwash usually is used these days because people they don't want to floss. And I understand. It's not fun, it's boring, but mouthwash cannot replace your floss. Floss will get the food out from in between your teeth. Mouthwash just goes around and it will help if you have gum inflammation. Also, so many mouthwashes says on them that they kill 99% of bacteria. So remember that 99% of bacteria in your mouth means your good bacteria too, your good oral flora. You don't want to kill all the good bacteria because then the number of bad bacteria will go up and you will get weird gum diseases. So do not mess with your oral environment. Go see your dentist, get a cleaning done, floss and brush. Mouthwash should only be used if your dentist recommends it. Don't just randomly get a mouthwash and use it. And definitely do not replace flossing by mouthwash because you're just kidding yourself. Guys, on Instagram, again, for the millionth time, we are on YouTube Live. And if you have any questions, come join our YouTube channel. The link is on our stories.
I've got a question from Mia. She asked that at what age do you do checkups on kids?
Very good question. For children, as soon as their teeth come out, it's a good time to go to the dentist. Not because that tooth needs any specific attention usually, but it's a good idea to get it checked with the dentist. So first of all, your baby, while they're young, start getting used to the dental chair and dentist environment, and it becomes a habit for them to go get their teeth checked. Second of all, there might be issues or questions that you have as a parent on how to treat your child's teeth, how to brush for them, what kind of toothpaste to use, stuff like that. In that case, the dentist can give you instructions on how to take care of your child's teeth. And from the beginning, you go correctly about it. You establish good habits for yourself and your child.
Thank you, Dr. Mia. I've got a question from a guy named Amir. He's asking that electric toothbrush or manual toothbrush?
Interesting guy.
Yeah.
Electric or manual, always a question, and I have few posts before. So if you go to our Instagram, a couple of our posts are literally about electric or manual. The answer to this question is they're both exactly the same if you do the same job and if you use them correctly. What does it mean? If you use a manual toothbrush and it's a hard toothbrush or a medium toothbrush and you really scrub, you're going to hurt your gums and you're going to lift your gums from the level they are. This issue is called a gum recession. If you're using electric toothbrush usually goes in circles. Imagine that it's going in circles and you're also rubbing it around and really scrubbing. That's also going to cause gum recession. So what should you do? Either use a manual soft bristle toothbrush, which is best, or use an electric toothbrush but properly. So hold the toothbrush on your teeth and then go to the next tooth. Don't rub it. The machine is already doing the job for you. You just need to hold it on the tooth and it'll do the job. In both cases, my recommendation is use a soft bristle toothbrush because you cannot harm your gums. Electric toothbrush can help because it will time you. It will usually, the good ones and more expensive ones will tell you if you are going too hard on the teeth, if you're scrubbing too hard, pressing too hard, and it will tell you you have done enough work. Some, toothbrushes tell you, oh, you're good now, you have done this part for 30 seconds, another 30 and another 30. So it will time for you. And again, it does the job for you, so it's moving around, it removes plaque and build up very efficiently. If you have any questions and you're on Instagram, jump on YouTube. The link is on our Instagram stories, and I see you there. And if you have any questions, I can answer on YouTube right now.
All right. We've got a final question.
Final questions, guys. Right. So if I'm finished with this, I'm going to go because I have a party to attend. But if you have more questions, jump in and ask, because after this one, I'm gone.
All right. It's not about the treatment. I think Catherine asked, why did you become a dentist?
It's a hard question to answer. I became a dentist. Why did I become a dentist? I became a dentist because, first of all, my mom's a dentist, so I grew up in her, dental office and hospital and practice, and I just saw this all my life. Second, I really loved helping people. I loved biology. I was always good at biology, human biology. I always would volunteer at school, even when I was a kid, to do presentations when it came to biology lesson, and my teacher really liked me. And I understood it, and I enjoyed it. And then also, my mom had an influence on me. I liked what she did and what she could do for people. So I actually first went to medicine. I went to become a GP. In 3 months, I didn't like it. I rather work with my hands. I'm very arty and crafty. I make stuff all the time. I'm good at painting and watercolor and stuff. So I gathered it's a good option to become a dentist, and I don't regret it. And to people who want to study dentistry, I say you have to love what you do, because it is genuinely a difficult job. It's draining. People don't like you. They hate you because they think that you are going to make them hurt and take their money. So you have to be very, very patient with all of this.
All right, thank you, Dr. Minu.
Thank
for
you.
your time.
Thank you so much for setting this up. Thank you, everyone. We've answered all the questions.